Hey guys, welcome back to San Antonio Living. I'm very excited about this next segment because you guys know I am a dog lover, and that includes, giving them a lot of love and making sure that they're very comfortable. Do we know if your dogs have allergies? Well, they can't talk to us, let us know, but no. Dr. Mixon is here from the Texas Vet Hospital to let us know some signs to look for. Who'd you bring here?
I have Itchy Bob with us. And,
Itchy Bob.
And luckily, he's a little bit of a misnomer, because when we first got him, he had fleas and mange and severe infection, but since then, he has been quite healthy as far as skin allergies are concerned, but
okay.
The Itchy Bob stuck.
Okay,
so,
Itchy Bob? Because?
Itchy Bob, because whenever he would walk, he couldn't walk without scratching and itching himself.
Aww.
And so my little girl named him Itchy,
okay.
And the rest of them named him Bob, so Itchy Bob is what stuck, and he comes to Itchy quite well, and so he likes that quite a bit, yes.
Okay, all right. Well, you know, I see he is not itching.
Right.
So all is well. But let's talk about some signs we need to look for on our dogs at home, our pets, that they might have allergies.
Exactly. Well, one of the common symptoms and signs that we hear about from our clients is shaking their ears, scratching excessively, licking excessively, and many times we don't get to see the pets until they keep the owners at night because they're licking and scratching and chewing all night, waking everybody up. And so, and we'll see signs with infection in the ears, the skin, you'll see hair loss, and sores, open, oozing sores and things like that can occur, and scabs. So it can be pretty nasty and pretty smelly.
Okay.
Women have better noses than men as far as that is concerned, so many times the wives will say, my dog doesn't smell right. And so then we'll see the infection and stuff underneath the hair coat, and we can get things started that way. And you know, with allergies, basically two words come to mind. One is frustration, and the other is patience. And many times it's a lifelong problem for these guys. And so the frustration comes in as you never cure them per se. You manage them and you maintain them, but you know, curing them typically doesn't happen. I mean, some dogs can outgrow it and we can get them past that, but it's an ongoing thing, and so that's where the patience comes in. It takes time. I see. And many times they're in the office, you know, a couple times a month getting care, and it just takes some time.
Hey, bud.
And
okay.
And so.
Well, other than the obvious of scratching and the licking, sometimes my dog has a really runny nose all the time.
Yes.
Is that okay, or should I be a little more concerned about a runny nose?
It can be allergies. Okay. If it's just clear drainage and just a little bit of drainage, probably not a big deal. But if you're seeing any color or thick mucus, things like that, then that's definitely, well, you usually have an infection.
That's not good.
Not good at all.
Okay, and at what point, whenever, let's say we go home, you guys are at work right now, you go home, take a look at your dog and say, you know what, I see some of these signs. How do we know it's too late, or is it never too late to come in and...
It's never too late. Okay. Never too late. We can do a lot. It may just take more time to get them better, because we have many dogs that we know that are allergic to, say, ragweed or cedar or oak, just like people are. Right. And they'll come in December for their allergy shot, or they need some medication just because the cedar's kicked in, they don't feel well, and we got to do something to help them out that way. And so many times it's a very cyclical thing, and we just know, oh, it's his time. And for Itchy Bob, lucky it's not a problem. We have many dogs that we see them every January because the cedar and the oak start mixing, and they don't have a good. They just start scratching and sneezing and stuff like that.
Well, Dr. Mixon, let me ask you something really quick, because naturally, if I have allergies, I take an allergy pill. Yes. If I see that my dog has symptoms of allergies that you just gave us, should I give my dog the same pill I'm taking, or is that a probably big no-no? It's a big no-no until you check. So talk to your veterinarian, and because many of the same medications that humans use, we can use in animals, but the dosing is very different, because obviously Itchy Bob is not going to get the same medicine as you, or at least the dosing anyway. And so, yeah, but a lot of times we adjust the dosing and it works very well. Very good. Okay, Itchy Bob, you look good, but I'm sure beforehand you didn't look so good. You look very healthy, but guys, if your dog doesn't look like Itchy Bob, you probably should come see Dr. Mixon at the Texas Veterinary Hospitals. I want to leave you with some more information on their many locations around town. In fact, they have 3. I'm sure there's one close to you off of Northwest Military Highway, Thousand Oaks, and Fredericksburg. My suggestion would be give them a call at 210-349-2121. If you have more questions about your dog, maybe there's something that's a little different, or you feel like your dog just needs a checkup, your pet, should I say. Yes. Yeah, you can see I'm the dog person here. Shelly's the cat person. All this information's online at TexasVeterinaryHospitals.com. Thanks for coming in.
Great. Thank you very much. Thank you for having me.
All right, guys.